This is Kipu NewsWire. I'm Bill Young. Today, meth, an escalating problem. Page 1. The opioid crisis is getting all the headlines as overdose deaths keep growing every year at a shocking 15 to 20% clip. However, recent data showing a 100% increase in deaths from methamphetamine is making politicians stand up and take notice. We're now fighting a major battle on two fronts. The biggest problem is what the two drugs have in common. Since around 2008, the purity of both heroin and meth have shot up dramatically while the prices have come down. It's no longer the warped science teacher gone rogue as portrayed on Breaking Bad. Large Mexican cartels have taken the business from backroom labs and ramped it up to an industrial-sized, large-scale business. They're simply passing their savings on to the consumer, taking a lesson from big tobacco, hoping to hook people in the process. Meantime, the U.S. drug policy is focusing most of its resources on enforcement and incarceration, rather than trying to curb demand for the product via prevention, diversion, or treatment programs. Page 2. The problem is meth. Meth was first recognized as a problem in the early 2000s when it became easy and popular to make using over-the-counter cold medicine that contained ephedrine. Back then, such medications could be bought directly off the shelf, just like any other over-the-counter medicine. As a result, Congress was forced to pass a law in 2005 limiting the amount of ephedrine that could be purchased, and the products were placed behind the counter requiring a signature. The government thought that the problem was solved, and for a while it was, but as we've seen, it just moves south of the border. Page 3. In 2013, methamphetamine passed marijuana as the most federally prosecuted drug by number of cases in America. More than twice as many meth cases were brought in 2016 than were brought for heroin. At the same time, law enforcement seizures of meth were 4 times higher than heroin by quantity. Meth offenders made up the highest percentage of drug offenders in 27 states in 2015. What we're seeing is that many people addicted to opioids are now also turning to meth as a solution. Some because there's simply a much lower chance of overdose. Regardless of the reason, it's a troubling development. Meth is also exacting a huge social cost. Government agencies in many communities are simply running out of places to put children removed from the homes of addicted parents. In Dunn County, Wisconsin, as an example, out-of-home placements of children surged over 800%. Parents of nearly 1/3 of the children in Montana's foster care system are methamphetamine users. The crux of the issue is best summed up by one mother, who says, quote, "Meth makes you forget you ever had children," unquote. Unfortunately, strict enforcement also has the unintended consequence of keeping addicts from seeking help because they're afraid of losing their kids. This creates a terrible catch-22 with no easy answer. Page 4. Meth still on the rise. Another less reported reason for meth's growth can be understood by simply talking to its users. Meth, mollies, ecstasy, and other variations of the drug create a high that's been described by users as a pleasure unlike anything I've ever known. This euphoria creates the feeling that doing everything on meth feels infinitely better, from sex to something as simple as taking a drink of water. The problem is that meth creates an obsessiveness unlike any other drug while taking a tremendous toll on the body. Self-care drops off to the point that hygiene and dental care grind to a halt. Many addicts, commonly referred to as meth heads, can be found missing many, if not all, of their teeth. Page 5. The threat. According to the National Drug Threat Assessment in 2016, nearly 1/3 of law enforcement officials ranked methamphetamine as the biggest drug threat in their area, with the southeastern and southwestern states as the biggest threats. Meth also leads to much higher arrest rates than most other drugs because it's a stimulant that increases energy and libido, and used at high levels for long periods of time can lead to paranoia and aggression. A 2010 study in Sydney, Australia, found that meth users were almost twice as likely as heroin users to have committed a violent act during the previous year. Page 6, the back page. As professionals in addiction treatment, we're all well aware of the problem of cross-addiction. It's rare that someone begins with meth as his or her initial drug of choice. Moreover, treating addiction to meth has proven more challenging than for any other drug. That's why total abstinence from all drugs is so critical in recovery. While it's disheartening to share stories like this, it's nonetheless important. We must continue to spread awareness of the problem to keep it from growing even further and spinning out of control. There's more on our website, kipuemr.com, or on Facebook, Twitter, and LinkedIn. For Kipu NewsWire, I'm Bill Young. Thanks for listening.